I want to spend the last few minutes and just really talk about two scenarios in our practice where we utilize this not only as a teaching tool, but a tool on how to progress with treatment of these patients. All right, so this patient right here got an implant placed. It was a type 4 placement, so it was in a healed graft site. The implant was loaded at 6 to 8 weeks, so it's early loading. The implant at placement had good stability. Actually, we probably could have loaded it at the time of placement, and we didn't. Everything went forward with this patient well. So nothing that really threw us for any concern. Now here's patient number 2. This patient is getting an implant placed in the canine site in an area where a tooth has failed. And this was a prosthetic failure. The tooth broke off at the gum line. It's not infected. It's a good candidate for immediate implant. So we proceeded with extraction of the tooth and placement of the implant. And it was in a submerged fashion, and we were going to let it heal for over 8 weeks. So it's going to be a conventional load. We also had primary stability, and we did submerged healing. Okay, so both of these patients had Osstell measurements taken at the time of surgery. So I want to bring up their charts from Osstell Connect. Okay, so patient number 1 on the left, you can see at the time of placement, the Osstell reading on it, ISQ was 68. And then the patient came back for uncovery and loading, and it was at a 70, which is something that we like to see. But one thing I want to point out is this implant was 4 millimeters below the tissue, and we had a hard time getting ISQ readings on it. And all I can tie to that is I would place it in there, and the readings it almost sometimes not read, and then we would have a brand new peg. We'd dry off everything and then get it in there again, and sometimes we get a reading. Now, clinically, this patient had no issues. There was no pain associated with this. The implant radiographically looked great. The tissues looked amazing. It was a beautiful result, but our ISQ measurement went down. You can see at the day we loaded it, it was at a 70. When she came back for her final impressions, it was at a 59. All right, so many people at that point would get really concerned, but I didn't get concerned at that point because I really thought that something was skewing our measurement there. If you look closely at this radiograph here, that temporary abutment, we had to modify that to get it seated fully. She had some really good bone coronally to that implant, and we had to cut off the emergence profile and go with a skinnier emergence profile. And while the smart peg does not extend beyond the outside of the implant, all I can think of is that we were having a problem with getting good seating. Maybe tissue was getting caught up in there, or something was happening that was really compromising that result. And the next time she comes in, she's back at 70. And that's when we proceeded with her final restoration. And when we went to deliver the final restoration, she was at a 70. So that's patient 1. And this is just understanding that something was skewed off here. Now, patient 2 is a different story. Patient 2 comes in, and that placement in that medial site, we had a reading of 59. Okay, so that's why that implant was submerged. When we uncovered the implant, it was at 63. So submerged at 59, uncovery at 63, and that's really nice. We loaded her implant at uncovery. So then she came back later. So she was from January 25th to March 1st. She came back, and we were going to make a final impression at that visit. And she said, and she has multiple implants in her mouth, so she knows when something's not right. She said, something's weird on that tooth, so I just don't want to even chew towards that side. So she had some odd pain on loading. So then we took the provisional off. We reverse torqued the implant. It would not come out. There was no mobility to the implant. We reverse torque it again, it would not come out. No mobility to the implant, but not loaded. And you can see how the Osstell has changed over time. So this is an implant that is not losing its integration, but there's something that's going on with it. Now, in June, we loaded the implant and she's asymptomatic. So there's a process of maybe we came in too early to put it in function, but we didn't have an implant that was failing. So these are the ways we utilize these tools to work with our not only with ourselves but with our residents as well. This is the really neat feature here. This is the export feature for our patients. It's an Osstell implant stability patient report, and it explains to them why we're doing all these readings. And this is something that you can also export and give to your patient.